Hello friends, let us now learn some new MCQs in prevention of diseases. First, all of the following represent specific protection mode of disease prevention except. See, first, option A, chemoprophylaxis for meningococcal meningitis is specific protection. Personal hygiene and environmental sanitation is not specific protection, right? It is general measures. Use of condoms is specific protection, and iodization of salt is also specific protection to overcome the thyroid disorders. Then next question, secondary level of prevention include all of the following except. Secondary level of prevention include option A, health screening for diabetes mellitus is secondary prevention. See, secondary level of prevention mainly includes diagnosis and treatment. Health screening of diabetes mellitus is secondary level of prevention. Case finding for falciparum malaria is secondary level. Contact tracing for STI is also secondary level of prevention. Reconstructive surgeries in leprosy is not the secondary level of prevention. Next question. In a population, to prevent the coronary artery disease, changing harmful lifestyles by education is referred as. In a population, to prevent coronary artery disease, changing harmful lifestyles by education is referred to as. Actually, that is primary prevention. Health education and specific protection comes under primary prevention. Then, next question. In an area with fluoride-rich water, defluoridation of water is which level of prevention? See, defluoridation of water is specific protection, so it is primary level of prevention. Sentinel surveillance gives us about the supplementary to routine notification. Then, to eradicate measles, percentage of population to be vaccinated is at least 95%. To eradicate measles, at least 95% of population should be vaccinated. Leprosy is considered as public health problem if the prevalence of leprosy is more than 1 per 10,000 population. Leprosy is considered as public health problem if the prevalence of leprosy is more than 1 per 10,000 population. Next question. Which of the following is an example of disability limitation in poliomyelitis? In poliomyelitis, disability limitation is resting affected limbs in neutral position indicates disability limitation in poliomyelitis. Right. Which of the following is the primordial prevention? Primordial prevention is prevention of emergence of development of risk factors is primordial prevention. Prevention of emergence of risk factors is primordial prevention. Even before the risk factors are developed, the prevention that we have is primordial prevention. In primary prevention, already the disease has been developed, and the prevention that we have after the development of disease is called as primary prevention. In primordial prevention, primordial prevention is done before the onset of risk factors. In primary prevention, risk factors are present but the disease has not yet occurred. In secondary prevention, disease has occurred but we are going to stop the progression of the disease in secondary prevention. In tertiary prevention, already the disability has occurred and now we are trying to remove the disability with the help of rehabilitation in tertiary prevention. Then, disability limitation is a mode of intervention for tertiary prevention. Which of the following is the most logical sequence? Most logical sequence include disease, impairment, disability and handicapped is the most logical sequence. Thank you for watching my lecture. Thank you.